Hello, Kara.
Hello.
So, how are you?
I'm very good, thanks. How are you?
I'm good. So, please introduce yourself.
So my name is Cara, as you said.
Yeah.
And I'm from Scotland, but I've been living and working in Thailand for the last 3 years, more than 3 years actually now. So I feel like Thailand's actually my home, and yeah.
So, what you are doing in Thailand?
So I've been working as a detox consultant in Orion Healing Center, based in Koh Phangan, a beautiful tropical island. So it's like a paradise, and I help people who come to do the different fasting programs. So I guide them through the programs, and yeah, like also teach about how to do colon cleansing and many different things.
So, you are basically in naturopathy.
Yeah, that's like what I'm based in.
Uh-huh. So, you do fasting?
Yeah.
You teach fasting. Fasting, dry fasting or juice fasting?
So I teach about like all kinds of fasting. So I talk about dry fasting, water fasting, juicing, but like I predominantly like to teach about juicing because it's a big passion of mine, and I also like to teach about healing, how you can heal your body through detoxifying with fruits and raw foods, but particularly with fruits. And juicing in particular, and I also like to teach people about how to transition in an organic way towards a raw vegan diet, but a fruit-based diet actually, based on the teachings of Dr. Robert Morse and Arnold Ehret.
Okay, so why you have come to India?
So I've come to India to get my amalgam fillings removed, because I was actually in Bangkok to get this done, because I'd also swallowed a bit of mercury. It was a chip, and I started to have some quite concerning health issues happen after that, which I actually noticed today have actually stopped since getting the major ones removed. I had tingling in my hands and feet, and I actually realized finally today, I was like, oh, that's actually stopped already, which is amazing. But anyway, I was in Bangkok, and I was looking up for holistic dentists that would provide the treatment in a safe way, because I recognize how important this is, because I've done a lot of research on this. And yeah, I found several dentists that on their website they said they did it in a safe way, but actually when I went to speak to them and I asked them about their protocol, they didn't follow many important safety procedures, and they even said to me there was a possibility that the vapor could still go down my throat, the mercury vapor, and they even suggested if you really want to make sure you're safe, you should find another dentist. And I finally realized that it wasn't actually possible, even though people were claiming they did it safely, to be able to find a place. So this is why I went onto a directory of the website, which includes all the certified safe practitioners for mercury.
So where are you right now?
Where am I?
Yeah, so where you consulted and where you have reached?
I'm in Haldwani in a Sai holistic dental practice.
Okay.
Yes.
So how is it? Have you got any treatment done?
Yes, so I've got a lot of treatment done so far. I had my the major issue was a cracked mercury filling, and I had that removed. And it was really nice, because normally I have a big fear about going to the dentist. But I felt very safe in this dental practice, and they play like beautiful meditation music, and I believe mantras that they begin the treatment with, which really helps. And I feel like the dentists are very knowledgeable, and they definitely know like everything what they're doing, so it makes me feel very secure and safe, and I don't think I could have come to a better place. So in a way, I'm grateful that I couldn't find somewhere in Thailand, so I could find this experience in this dental clinic. Yes.
In India?
In India, yes, correct.
Okay. So, whom you have consulted? Who is the doctor you have consulted?
It's Dr. Anand Gupta.
Mm-hmm. Tell us about him.
Yes, he's been helping me so much along my journey, not only with my teeth, but also within navigating India, because I've never been to India before, and it's quite like a new experience for me. And also I'm staying in a beautiful room on top of the clinic, which is amazing because it has so much natural sunlight in the day. And before I was finding it quite hard to find a hotel which wasn't very loud or didn't really have any possibility to be with the sun, with the light, this kind of thing. So I'm very happy to be here, and it has a lovely kitchen also, and it also means it's convenient because when I need to get the work done, I can just, it's easy trip there and back. Otherwise, sometimes when you get your work done, you just want to, the dental work done, you just want to rest. You don't want to be traveling back and forth. So in that way, it's very good.
Okay, so they follow all the protocols of the removal?
All of the protocols.
Okay, so you are satisfied following them?
100%. Otherwise, I wouldn't be here, and I wouldn't have made the effort to fly all the way from Thailand to India for this.
Okay.
Yeah.
Anything you want to say to the people who are having mercury fillings, as you are a detox teacher yourself?
Yes, well, I would say that if you have mercury fillings, to get them removed as soon as possible, because they can have detrimental effects to your health. Because even when you're, for example, drinking hot drinks or cold drinks, or eating in general, it's like slowly eroding the mercury, and this is going inside your body. Mm-hmm. And you really don't want this, and it can cause like neurological problems, like so many different problems. Mm-hmm. And then it's a process to detox it out your body. And so, I also, for those of you who are aware, there's a saying which is called, which is like famous. I don't know in other countries, but in the UK they say like, as mad as a hatter. And the reason they have this saying is because back many years ago, hatters used to use mercury to make their hats, and they all went mad because of this mercury. So you can only imagine what this substance is doing in our mouth, and why it's so important to get it removed. So I recommend to educate yourself and watch documentaries about.
So Kara, is there any difference you saw in your life or in your body after removing the mercury from your teeth and filling them with ceramic?
There is a monumental difference, because one of the things, the experiences I had from the mercury, specifically it was after accidentally swallowing a piece of mercury, chip of the tooth, was that I started to have quite intense tingling in both my feet and hands, and it was quite scary because it was every single day, every night and every day. Also I had some problems with the ability to use my hands. It would just be that I would be, for example, doing the washing up, and they would go it would be like they would sort of seize up but also go limp. So I felt like it was terrifying for me, because I felt like what was happening to me, it was very strange. And then I realized shortly after getting the main culprit, which was the biggest cracked one, and that was chipping away. I noticed that the tingling in my hands and feet stopped finally, and also I realized that I was able to use my hands. I felt a lot more strength in them, and I didn't have the same experiences that I'd been having previously that had been happening on and off since the tingling had started, which had been going on for several months. It'd be going on for about 4 months until I got here. So yeah.
Oh, that's wonderful. So you are saying once the mercury is removed, so you are not having any tingling sensation in your hands and feet, and you are able to work in a very comfortable manner after that?
Yeah, like I was having some issues with the ability to use my hands properly, and that went away. So
Okay.
yeah, that would be on and off, but still it was very concerning, and I realized I feel like totally different now in my hands than before. So yeah.
So I remember that you got one surgery also done, one tooth was removed. So were you given any antibiotics or painkillers after that?
So I was given homeopathic medicine for this. I definitely don't advocate the use of antibiotics because their effects can be more adverse than beneficial, their side effects. But yeah, they were fine for me to take, but I didn't actually feel like I needed them so much because I actually had no pain. Like I took them, and then before I went to sleep, and then when I woke up, I took them at about 6 a.m. because I thought like that's what I should do because I was instructed to do that. But then I didn't have any pain at that time, so I just decided to stop taking them. But then I understood later that you need to gradually come off them. But yeah, it was quite interesting to realize that to see that I could have like a whole tooth removed and have like no pain basically.
Oh, wonderful. So you
Yeah.
are saying that there was no complication and there was no discomfort after the tooth was removed in a biological manner?
No, I didn't have any problems at all.
Okay.
Yeah.
So how are you as of now after the surgery, after the amalgam removal?
I feel like I have a new lease on life because it was something that was bothering me particularly for 4 months. It was causing me a big amount of stress, but even before then, it was for 6 years I wanted to get them removed, and I felt like such a relief to get them removed. And I also realized that when we release things that are no longer serving us, more things can come in. So I feel like because I released these teeth, this tooth and this mercury, and I decided to take care of myself and love myself enough to do this procedure, then amazing, beautiful things have been happening in my life. And as well, like I just want to say to anyone watching this that your health is your greatest wealth, and it doesn't matter about the other things because you can't even enjoy the other things if you don't have your health. And for a long time I was burying my head in the sand about this, so yeah, this is just my advice. It's so important.
Thank you.
Thank you.